Good day. Thank you very much for that kind introduction and the opportunity to share my experience. Again, I'm Dr. Michael Dennis de la Paz, and the topic that I would be talking about is entitled Harnessing Technology to Improve Surgical Safety. I have nothing to disclose. In fact, I am inspired with the ironic quote of the late innovator Steve Jobs, wherein he states that technology is nothing. What's important is that you have faith in people, that they're basically good and smart, and if you give them tools, they'll do wonderful things with them. And that, I think, would be the essence of my lecture. I would start first with the two keywords of my topic. Number one is technology. It is a broad concept but basically defined as practical application of knowledge to a particular area. Although association of technology to health or surgical care has created a misconception that involves the latest manufactured tangible design or it comes with a higher cost, this misconception is actually partly true. And the other part is that it is not only a device but a system of ideas, as simple as a checklist or as a complex as a computer-based software applications that can improve any kind of process. And in my lecture is the second term, which is surgical safety, which is ensuring our patient undergoing surgery away from further untoward harm or risk, which is a tough goal because it encompasses a lot of areas, not only clinical, technical, and psychological aspect, but also socio-cultural, ethical, and economical aspect. With this said, the main objective of this lecture is to discuss the technology that are being used in surgical care and the benefit and risks, how they are regulated. More on the benefits, how can this technology improve patient safety and how us physicians and surgeons can contribute to the successful implementation and use of technology to improve patient safety. Technology in healthcare is exponential and it has transformed healthcare delivery in a way that personnel are increasingly becoming more reliant on technology for their day to day practice. Although the use of technology to improve healthcare is compelling and becoming a necessity, we should always be careful, especially if we are talking on how to improve patient safety because it can also introduce new hazards. Factors such as poor or inappropriate design, misuse of equipments, and over reliance on technology can also result in the technology compromising safety. That is the reason why we are here, the end users, to design, innovate, regulate, implement, and train appropriately on the proper use of technology in order for us to better ensure the safety of our patients. Again, I want to emphasize that the healthcare technology does not only refer to a development of new medical devices and equipment, but it encompasses on the as basic as cell phone or computers that we are using right now, or as sophisticated as the hospital information system of a large tertiary hospitals here in the Philippines. How can these technologies help? It can help a lot in different processes ranging from automatically managing our clinics and office, especially right now during the time of pandemic, we are prevented from face-to-face consultation. But through the technology of telemedicine or teleconsultation, we are able to safely care and manage our patient. In the surgical field, the new diagnostic technology had accurately informed us with the proper diagnosis and surgical management of our patient. The new laparoscopic and robotic surgical machines enhance our capability of operating our patient with minimal or without any scar, hence better recovery and quality of life of our patients. Lastly, with the medical system software, the electronic health records have prevented error from illegible handwriting of doctors and automated monitoring system that would keep patients safe in many aspects such as notification of their medications and follow-ups. The important data being collected there will be used further for big data analytics to further improve our surgical care, hence safety of our patient. Here in the Philippines, we are guided by Republic Act number 9 711 enacted last August 2009, which created the Food and Drug Administration in the Department of Health, which created four centers, one of which is the Center for Device Regulation, Radiation Health and Research, or the CDRRHD, which is the major regulatory body for these healthcare technologies, wherein they grant license for use and operations if the new technologies complies with their safety and standards. But what I want to share is to further extend our idea of healthcare technology in the international level, and on top of mind is the World Health Organization Patient Safety Technology Program, which created four working groups. One is for the introduction of new technologies, the other is for making existing technologies safer, another focus on the information technology, which is a trend nowadays in big data analytics, and lastly, and the very much important, is the simulation and training, wherein there is a trend of instead of learning risky mistakes from our patients, surgeons will be hone their skills through simulators for them later on do the right skills to their patients without the harm of first-time mistakes. With special consideration on the challenges for the developing countries, these are some of the successful technology of WHO safety program. It is stated that it is not more on high-end technology like the computer simulation for surgery, but on how it can be global. The nature of technology solutions must be tailored on the local needs, especially on the developing countries like ours in the Philippines. WHO termed it as an appropriate technology. One appropriate technology that we're applying right now is the WHO safety checklist, which is a low technology but high in improvement in safety. Those existing technologies that I mentioned, although as low or as high technology they may be, I guess it would not be that perfect as what we are thinking that can achieve absolute safety, but at least there is a constant development and analysis of what can be further done in order to achieve safety further. Like in this busy flowchart of surgical care to a patient, from admissions to operations up until discharge and home care, every process has a lot of existing surgical safety technology like diagnostic systems, safety monitors, minimally invasive surgery devices, and many more to mention. Unfortunately, this comes with the pitfalls like equipment failures. Interestingly, research had found out some innovative ways to make surgical care safer, even with low technology like the WHO safety checklist that had prevented a lot of surgical risks such as wrong patient, wrong operations, wrong site, and even retained foreign body incident during operations. It is also important to recognize in this workflow that technologies can pose many hazards. That is very important disclosure you should also present to our patient. Some of these relate to improper and careless use. For instance, if technology is introduced too quickly and without thought for the culture and the clinical setting, or without appropriate training and even improper servicing, maintenance, and constant calibration, or in standardization, safety can be in danger. And before I summarize my point of harnessing technology in surgical safety, I would want to share my personal journey as a surgeon with regards to technology and the recent technology we are working that can possibly improve surgical care. I was unfortunate, or maybe fortunate, to train in a government hospital who is lacking in technology. What I learned there is how to innovate available surgical materials in order for us to still provide the best needed surgical care to our less fortunate countrymen. When I graduated the program, I lacked the skills in the latest technology of laparoscopy and robotic surgery. That is the reason why I applied for a fellowship program in minimally invasive surgery, but it was very competitive and financially draining, especially if you take your training abroad. I ended up training here locally, and one of our signature innovation is how to train a high-tech driven skills using a low-tech or economically and readily available device and materials, which is I'll show in this video clip entitled Art in Laparoscopy. And I presented it just last year. So please enjoy this video. Okay, I hope you find that simple technology for training interesting. And just this semester, while I am completing my requirements for hospital administration course in UST Graduate School, we have this promising project utilizing smartphone applications to artificial intelligence and telementoring functions for a specific surgical safety purpose, which was presented just last week at the Asia Congress of Robotics and Laparoscopic Surgery online in Seoul, Korea. So they gave us a promising recommendations, and please enjoy these another video clips.
Good day, I'm Dr. Michael Dennis de la Paz from the Philippines, and I am here to present a development and pilot testing of an intraoperative smartphone app that can help surgeons during laparoscopic cholecystectomy procedures. I have nothing to disclose, and you may take pictures. We started this project because even with the strong advocacy of Safe Cholecystectomy Program and Zero Bile Duct Injury in Laparoscopic Cholecystectomy campaign, there is still a gap that the census is still not zero. Much more, it may be an underestimation since not all laparoscopic cholecystectomies done in the country are not properly registered or accounted. So the main objective of this study is to further find a way to prevent bile duct injury complications during laparoscopic cholecystectomy to a trained surgeon right immediately before it happened using the mobile phone app timeout procedure. The key feature of this app is a real-time checklist assessment of taking a doublet view of the picture of the dissected hepatocystic triangle of the gallbladder, showing the requirements of critical view of safety before cutting any structures. It is equipped with a deep learning image recognition capability of instantly analyzing critical view of safety structures. Moreover, it has a real-time networking telementoring function to distribute to a given picture to any available surgeon for them to analyze the picture also and provide a very essential help to properly decide and manage the case. The initial concept during the developmental phase that during any given laparoscopic cholecystectomy procedure, once the surgeon had carefully dissected the hepatocystic triangle, exposing the necessary structure of the critical view of safety, namely the cystic duct, the cystic artery, and at least one-third of the cystic plate, there would be a timeout before clipping and ligating any structure in the form of a smartphone app that would take picture of the critical view of safety in doublet view, and it will be analyzed immediately by both the artificial intelligence of the program as well by the available expert surgeon connected to the app. There are two scenarios in this procedure. If the surgeon did well in the dissection and exposure of the necessary critical view of safety structures, the app would emphasize on the critical view of safety and analyze if the critical view of safety is achieved through percentage. The telemetry function of the app would also gather consensus of the expert surgeon if it's safe to clip, plus they could also point out the structure which is safe to clip and ligate through telestration. Absolutely, if it says yes to both the program and the mentor, it is safe to clip and ligate. In case of danger scenario that the surgeon mistaken to recognize or wrongly perceive a common bile duct as a cystic duct, or if the critical view of safety is not well achieved, both the program of the app as well as the consensus of the expert surgeon would warn the surgeon not to clip or ligate any structure which might prevent any bile duct injury. And if there is really difficulty in achieving the critical view of safety due to various reasons, the app would have an important feature to call for help for any available nearby expert surgeon to scrub in immediately and assist the surgeon to prevent any complication during the procedure. The primary outcome of this endeavor is to absolutely prevent bile duct injury to the laparoscopic cholecystectomy. The secondary outcome of this app is that it could serve as a laparoscopic cholecystectomy registry that could provide a surgical big data analysis that could help surgeons as well as patients with regards to quality and safety of laparoscopic cholecystectomy. The main limitation would be the issues on data privacy and confidentiality of both the surgeons and the patients. The ethical and legal aspect of using such technology as a third party during the procedure, the socio-economic and technological aspect of the country is also a limiting factor. Like here in the Philippines, some of our remote areas have no internet connections. This is the preliminary testing we did to the app. wherein we use the cholecystectomy AI as a platform in analyzing the critical view of safety pictures. It used a deep learning system of Python and TensorFlow, utilizing 200 critical view of safety pictures, which analyzed any given picture compared to that what it had learned, showing the outcome in percentage. 80% is a threshold. Preliminary, what we did is a mock study using educational critical view of safety pictures of perceived critical view of safety from the textbook as well as the web, with known outcome of either safe laparoscopic cholecystectomy or with unfortunate bile duct injury complication. A total of 20 pictures were initially analyzed by both the artificial intelligence and the telementoring network of expert surgeons of that picture of safe critical view of safety using laparoscopic cholecystectomy. Initial study shows that the AI component of the app is at par with that of the standard decisions of the expert surgeons, with an excellent positive predictive value and a high negative predictive value due to an incidental number of false negative detected by the AI. Added to that outcome, a good participation of expert surgeons was registered, especially during the working hours, and 100% there is always someone available to volunteer nearby in all laparoscopic cholecystectomy pictures where critical view of safety is difficult to achieve. The future of safety of laparoscopic cholecystectomy is kind. In fact, the future may be existing now in the present day, as various technological advancements like application of laparoscopic ultrasound, fluorescence dye, diagnostic radiologic augmented reality system, outstanding high-definition imaging system, endoscopic and robotic surgical application advancement, and virtual simulated surgical training technology have some promising effect in preventing bile duct injuries in laparoscopic cholecystectomy by enhancing the senses and skills of surgeons for them to dissect and identify the necessary anatomical structures systematically, accurately, and safely. Unfortunately, those are very costly for the hospital and the patient to be acquired. But still, the future is kind, for cost-effective technology is still disrupting by the use of real-time telementoring and utilizing the video or image recognition through computer artificial intelligence. In conclusion, with the mock preliminary study we had, smartphone app can be readily utilized as an added armamentarium as a crucial time-out procedure to ensure safety during laparoscopic cholecystectomy. Further development of the app and using it on actual operating room study could be done. Thank you very much.
So in summary, my lecture is not intended to provide an exhaustive review about technology and patient safety, but it gives a snapshot or a starting point on how can we harness technology in our practice, especially with highest regards to our outmost clients, our dear patients. To ensure their utmost safety, we have to embrace also technology. Again, these are just tools and we should embrace it appropriately, and the safety of our patients will always be on our hands. I think that would be my take home message, and thank you very much.